Good morning, everyone. My name is Rachel Rose, and I'm an occupational therapist at UI Healthcare. I hope you had a great morning so far, and I'm here to lead you with some breathing exercises, some arm stretches, and we'll do some trunk rotations and finger flicks as well. And then Stephanie, my colleague, will join in and do some lower extremity movements as well. So, all right. First things first, make sure that you have things out of the way in case you were to kind of knock something over. Just kind of push it out. We'll be reaching today. And then next thing, make sure you have a sturdy seat. And you're going to sit up nice and tall, feet on the ground if you can. And remember not to force anything. Just do what you can. And I'll kind of talk a little bit about modifications too. So here we go. So we're going to start with some breathing to begin. And we're going to start in this position, almost like you're going to box. And we are going to breathe in through your nose and then out through your mouth. And you can do one of 3 breathing techniques. The first one will be pursed lips, like you're blowing out birthday candles. So the second one being an SH sound, so a shh. And the last one being just an S sound, like a snake. And that's really gonna, put your core to work, okay? So we'll do 4 of these, just mirror me. And remember to be nice and tall in your chest, shoulders out. And then for your back, if you have 2 shoulder blades, just make sure that they're touching, okay? All right, ready? So we're in the start position, and you're gonna breathe in through your nose. Open up the chest and breathe out. And 2. And breathe out. 3. And 4. Make sure you're squeezing those shoulder blades. Good. Okay. Now the next exercise we're going to do, we're going to be reaching. So you're going to be weight shifting through the right side and the left. And we're going to add an arm component to that. So make sure you're reaching like you're putting something away on the top shelf, and then back to center. And reach, back to center. Reach, back to center. Reach, back to center. And with these, you can continue your breathing. So we're going to breathe in and out. Breathe in and out. Good. All right. And number 3, the third exercise we're going to do is with your core and trunk. So I'll have you take your left hand. I might be opposite than you, but your left hand, you're going to place it on your right knee. And if this is enough of a stretch for you, you can hang out right here. Or you can take your right hand and stick it behind you. And you're going to look to the right side. And you're going to get a nice twist. Don't force or really pull anything, but we're going to hold it here. We're going to breathe in through your nose, out through your mouth. And return back to center. We're going to take it over to the left. So take your right hand, place it on your knee, and you're going to reach and look to your left. Breathe in through your nose and out through your mouth. Good, back to center. Now we're going to do 4 more of those, okay? Let's go to the right. Breathe in, chest tall, and out. Over to the left. Breathe in, nice and tall, and out. Good. Keep it going. Breathe it in through your nose, out through your mouth. Take it to the left. In through your nose, out through your mouth. Let's do 1 more for good measure. Over to the right, last one. Make it your best one. Breathe in. and out. And try and stay tall on this last one. Chest high. Good job. And last to finish up, if you worked with me, you know I love these. They're great for your hands to wake them up. We're gonna start fists kind of up near your chest, and we're gonna open and extend all your digits wide. Feel a great big stretch. We're gonna do it 5 times together. 1, 2, 3, 4, 5. Good. All right, and I'm counting, but you can work on your breathing during these as well. Ready? 5 more. 1, 2, 3, 4, 5. And then your last one, you're gonna do a last set, and I want them to be your biggest one. You can even add some elbow motion into it as well to end the movement. So we're gonna go 1, 2, 3, 4, and 5. All right, good job, guys. Hope you enjoyed this little upper body stretch, and I'm gonna get Stephanie, and she's gonna take you through the lower body.
Hi everyone, my name is Stephanie Evans. I'm a physical therapist for UI Healthcare. I am going to get your legs moving a little bit. So these exercises can be ones that can be done if you have issues with your blood pressure being kind of low and you tend to get a little lightheaded when you stand up. These ones are good to remember to incorporate. So the first ones we're going to do is heel raises. So I want you to work on pressing up to your toes and putting your heels back on the floor. Up big, down to the floor. So we're going to do 5 more of these. 2, 3, 4, 5. Good. Next one, I want you to stay sitting up tall, and we're going to work on a big march. So again, I want these movements to be big and slow. So we want everything to feel very deliberate. And let's go up, down, up, down. If you need a little bit more support, you can put your hands on the arm of your chair or down by your sides to get a little bit better lift. But for added challenge, hands on your knees to really make you have to shift your weight side to side. Let's do 1 more on each side. Good. Okay, we're gonna increase the difficulty a bit with this. And the next one, we're gonna raise opposite arm with your march, okay? So big reach up towards the ceiling. Good. Opposite arm, opposite leg. Good, let's do 2 more on each side. Very good. Okay, next one, we're gonna do a sideways step. So I want you to step out and back, out and back. And it's really easy to rush these exercises, so I want you to pretend that you're stepping over something. Maybe you have a hurdle, little hurdle there, your dog's sleeping down here. I want you to keep it nice and big and slow. Out, together, out, together. Let's do just a few more. Side to side, and again, if you need a little bit more support, you can have your arms on the armrests of your chair, or you can have it down at your side. Last one. Good. All right, let's do a reset of our posture. And the next one we're going to do is add another degree of difficulty. We're going to add a reach with it. So you're going to try to reach out at the same time you move that leg. Out, together, out, together. Nice slow cadence, big deliberate movements. And keep keep those fingers spread nice and big too. We're going to work on a little bit more of the arm stretching and hand stretching when you do this one. Good. All right, nicely done. For the next one, for those of you who know me, you're going to be really familiar with this one. I give it to all of my patients. I want you to work on standing up from your chair and sitting back down. So if you need to take a minute, go ahead and slide your chair back, get yourself positioned. And for safety, you can use your arms to push up. Or for a little added degree of difficulty, you can try the big reach, where you reach forward and stand up and come back down. Stand up and come back down. Okay, we're going to do 5 in a row. 1, 2, 3, 4. Make sure you're getting that head clear forward. 5. Very good job. I hope you enjoyed the rest of the symposium. For those of you that I haven't seen in a while, I hope you're doing well. I can't wait to see you in person again. And thank you for your time. Feel free to take a little break now if you need it. And as I said, enjoy the rest of the symposium.
So actually, I was planning to go to Ms. Evans and Ms. Rose, our wonderful physical therapists and occupational therapists. So there are several questions I would like to ask. So how can I improve my balance? Is there anything that can be done to stop my falling? Stephanie?
So I think one important thing to note with that question is figuring out why there is a loss of balance and why the falls are happening. So when we examine someone in physical therapy, we look at multiple different testing strategies to try to figure out where these are coming from. So, orthostatic hypotension was mentioned a lot, and sometimes people don't realize that the lightheadedness is that initial trigger that can cause a fall. Freezing of gait is another one where if we really ask specific questions about which direction someone's falling, we can figure out if it's from freezing versus postural instability with a loss of balance. And so I think that is important to tease out, and that's where us in rehab can help. And then as far as rehabbing for it, I definitely see progress with improving balance. We offer a safe environment to challenge balance reactions. And so I talk to patients about doing things that we can make your reactions a bit quicker, a bit more effective. And it varies from person to person, the results we get, but I can tell you that typically we get really good results with people. And along with that, assistive device assessments are also important. So it may be that you need to start using a cane for another little touch point for balance. So multiple things that we look at, and we do testing to track over time for balance reactions.
Thank you. So I would like to continue with Rachel. So there's a question about how can OT help with technology? The attendee has difficulty operating the smartphone and the tablet.
Yes, good question. And echoing off of what Stephanie had mentioned, we really have to see what's going on. Is it, you're overshooting, undershooting, kind of getting you in and evaluating what part is hard, or is it the pressure, or is the tremor maybe, kind of getting out of control? So just having a really clear vision of what's going on. And then sometimes we can provide some stress reduction techniques to kind of counteract that tremor. Maybe we have some tactile cues. There's a lot right now in today's technology for increasing font size, slowing down the speed of some options with iPhones and computers. So those are just some compensatory ways. And then in tandem, we always try to first remediate some of those movements, making them larger, and then controlling the tremor as best as we can from a non-pharmacological standpoint.
Thank you. So again, this question for Stephanie and Rachel together, perhaps. So the question is, what is typical in planning for housing as the disease progresses? So what kind of adjustments to home or perhaps assisted living and so forth? Could you expand on these types of options?
You know, from a walking and balance standpoint, we usually talk to people about the space inside their home, reducing clutter. For people who have freezing of gait, this is particularly important. And other modifications that may be a little bit easier to follow through on are choosing surfaces to sit on that are easier to get up from. So, and also the bed height can be something that we look at for adaptations to current homes. Those can be pretty quick and easy to implement for people. And then I often do have the discussion regarding the time when it's maybe you need to consider moving into a different environment, including assisted living. The care partner's ability to provide, you know, what the person needs is really important, and how that stress is impacting, you know, both people is important. So this is a conversation that comes up a lot when I'm seeing people in physical therapy.
And going off of that, we can also add adaptive equipment, which I tend to recommend in the bathroom. So grab bars, elevated toilet seats, some non-slip strips so that you have a little bit more traction getting in and out of the bathtub or shower. And then even putting some cues on the floor for turning to get into your chair, or maybe on steps, so that it just increases the safety and provides a little bit more stability.
Thank you.